So, bago na po ulit ang ating topic, olfactory diagnosis overview. Olfactory diagnosis. Olfactory po yung ginagamit natin yung ating mga pangamoyan. The second aspect of the diagnostic pillar, listening and smelling, is the impression we receive from the client by the nose. Unfortunately, these impressions are more difficult to use in modern times in the developed world. This is because many people bath daily and wash their clothes frequently, as well as using deodorant, creams, perfume, etc. This means that we often cannot smell their natural odor because they have washed it off their body and out of their clothes and mask it with various fragrances. A trick can be to get the patient to put a t-shirt, vest, or pillow case that they have been using in a plastic bag, which they then tie and then bring into the clinic. So yung padadalhin po natin ng mga ginamit na damit. Making the odors more prominent. In general, the odors that have a diagnostic significance can be difficult to smell. It is usually only when there is a very dominant smell that is noticeable. If we do pick up a certain odor, it usually has diagnostic significance. In this situation, it is often a very important diagnostic sign. So there are two aspects of olfactory diagnosis. First, the person's body odor, which can provide information that can help to determine a person's constitutional type or their imbalance in 5-element acupuncture diagnosis. Second, the diagnostic significance of the various discharges and excretion from the body. Olfactory diagnosis plays a central role in the 5 elements acupuncture system, founded by J.R. Worsley and the school inspired by him place great emphasis on training their student to be able to distinguish between the odors that resonate with the 5 phases. It is considered a serious sign of imbalance if a person does not manifest the odor that is characteristic for their own constitutional types, but instead has the smell of one of the other phases odors. So, ibig sabihin po, pag natapat ka dun sa hindi mo, kasi kung yung pagkatao mo po ay yung body constitution mo ay nasa metal, then biglang naamoy ka na nasa fire, yung palang po nalalaman na may disharmony. So, the following description of the odors are mainly based on 5 elements, constitutional acupuncture by John Hicks, Angela Hicks and Peter Moll, and J.R. Worsley book, yung Traditional Acupuncture Volume Traditional Diagnosis. So pag water paste po, malalaman po ninyo kung rotten and putrid yung amoy ano. So pag ganyan po yung amoy, the Chinese character fu can be translated into English as putrid. The character is built up of 2 components. The first has the meaning of a building or shed, and the second component means to dry meat that is tied together. This gives the character a sense of the odor you would expect to smell in the shed that is used to dry meat. The difference between this odor and the odor of the metal paste is that the fu odor is more tart and caustic. So, yun po yung mga pagkakaiba niya, no? So, pag wood paste po, rancid. Sour this smell is called in Chinese. So, it's the smell that animals or urine can have. This is rancid, is unrancid butter or rancid fats. Parang panis. But even sharper, Hicks et al. Describe this smell as newly mown grass, but without that smell being pleasant. Pag fireplace naman ay burn. So this odor is called chowu in Chinese. The smell can be described as being similar to toast that has been burned, clothes that have just come out of a tumble dryer, a shirt that has been burnt with an iron. So na-imagine na po natin yung amoy or vegetable burning dry in a saucepan. Ibig sabihin, amoy tutong. In the same way that the smell varies depending on what it is that is burning. The burnt smell can vary from person to person. The aroma may be noticed with the person has a high fever. So yun, earth paste. Pag earth paste po ay sweet and aromatic. The Chinese word xiang means aromatic. It is a word that is used in name of many aromatic herbs, for example. This can be misleading as the odor referred to here as a heavy, sticky, almost nauseating aroma. So yun, sweet and aromatic po yun. So metal paste, yan naman po ay yung ruten. Ruten is land in Chinese. This is the ruten odor that is smelled when the meat, fish, or vegetable root. This odor can be smelled in old, disturbing, or garbage truck. So, ayan po yung phases ng ating five elements. Water, significance po niya ay putrid. Pag wood po ay rancid. Pag fire ay burnt. Pag earth, sweet and aromatic. Pag metal ay rotten. So some imbalances can give a specific smell that can be difficult to describe, but are immediately recognizable when you notice them on other patients with the same pattern of imbalance. The patient, for example, often have a very heavy, sticky odor. It smells a bit like a wet leather jacket, but it lingers in the room long after the person has left. Sometimes you can go in the treatment room an hour after they have gone, and the smell still lingers in the air. Naiiwan doon sa kwarto yung mga amoy ng ating mga pasyente. So, olfactory diagnosis of the body's excretion. We are usually dependent on the patient reporting of how the various discharges and excretion from the body smell. Very few clients bring an example of their stools, urine, or vaginal discharge for inspection in the clinic. We can, though, still smell things like their sweat and their breath during the consultation. A general rule of thumb is that the strong smelling, excretion, and discharges are a sign of heat. So if there is no significant odor to the discharge, this will not be pathological unless there is a change in the volume. Di ba yung sobrang lumalabas ay marami talaga. Di ba sa mga babae po, may time na yung mga tinatawag po ng mga babae white menses. Minsan yung ibang babae po napakarami, kaya hindi po yun normal. So consistency of frequency of the discharge. These aspects are dealt with as section 1 and 4 on visual diagnosis and interviewing. So, olfactory diagnosis of the urine and stools. Urine and stools that have a strong odor will most often be sign of excess heat, usually damp heat. So, if the stool or urine does not smell, the lack of smell will only be relevant if there are other disturbances in the frequency and consistency. Wait po at dahil biglang may pumasok sa aking laptop. Sa akin. Dok, saglit po may nangyari sa laptop ko. Okay. If the stool or urine does not smell, sabi nga, Kung wala naman tong amoy, pero yung volume niya ay marami, yun ang merong clinical significance. So, and consists of the stool or volume and frequency of the urine, in which case the lack of odor can contribute to a diagnosis of excess cold or young deficiency cold. So pag yung wala namang kaamoy-amoy na, pwedeng tingnan ninyo baka may cold na rin syempre. Bukod dun sa naamoy ninyo, i-double check na po natin sa tongue and pulse para tumama yung ating pag-diagnose. Stools that smell like sewage will be a symptom of food stagnation. So, olfactory diagnosis of sweat, mga pawis. Paano? A strong body odor from sweating is manifestation of damp heat. Yun, sobrang maamoy talaga yung mga pawis nila. As explained in the introduction, this will probably be something that you have to ask the patient about, because the strong body odor means they will have used deodorants and antiperspirant. O, dapat tatanungin mo na ninyo, baka naman may ginamit nga. So sometimes, though you can still smell the sweat because the odor is very strong, or your nose is close to their body, whilst treating them with needles. So olfactory diagnosis of the breath. A person's breath can sometimes be smelled whilst conducting visual diagnosis of the tongue or niggling points in the face. May na ninyo kasi malapit kayo sa mukha eh. Otherwise, it will be something you have to ask about. Malador's breath can result from imbalance in the stomach. Yung kakaiba kahit nag-toothbrush siya talagang maamoy. Spleen and large intestine. Heat from the stomach, fire, or food stagnation can rise up the mouth and be smelled on the breath. Yung sabi nga po, minsan may pasyente tayo, nag-toothbrush naman ako pero ba't laging parang bad breath ako? So yun po. Maaari siyang may heat in the stomach and large intestine channels. Large intestine. Then, heat in the stomach and large intestine channel can result in parodontosis, rotten teeth, etc., which can give bad breath. So, olfactory diagnosis of nasal and pulmonary mucus. This will more likely be something the client can taste, but sometimes it is so powerful that the therapist also can smell it. If sputum in the lungs is infected, it may smell slightly of fish, yung parang malangsa yung karap mo habang kinakausap mo. So, yun. This will be experienced when there is toxic fire in the lungs. So, pag ganun po, may toxic fire in the lungs. Strongly smelling mucus in the nose will be a sign of lung heat. Yung sa ilong lang nila, inaamoy nila sa parang iba talaga. So, lung heat po yun. Olfactory diagnosis of menstrual blood and vaginal discharge. So, menstrual blood and vaginal discharge that have a strong pungent odor is a sign of damp heat. If the vaginal discharge is a fishy odor, it is a sign of damp cold. Sa mga babae pong mga pasyente natin, minsan ako tinatanong ko to, yung pag lumalabas, talagang tinatanong po natin, lalo pa kung ang chief complaint nila, sobrang masakit yung kanilang puso pag nagre-regla. Para alam natin, yan, tinatanong, masyado bang maamoy yung amoy ng mens mo? Gano'n. So, kasi sasagutin ka naman nila dahil naamoy nila yun. Olfactory diagnosis of flatulence. An increased amount of intestinal gas that smells strongly is a sign of damp heat or an extreme cases. So, toxic fire in the large intestine, an increased amount of intestinal gas that does not smell is a sign of extreme tissue. Kaya po, may mga taong hindi po ba pag umuutot sila, sobrang maamoy. So, alam natin na pag gano'n, damp heat. Meron namang pag may umutot pero wala lang amoy. So, possible din silang spring chi deficiency. The smell of excretion and discharges. Ito po yung ating summary. So, observation, pag strong smelling ng urine, excessive po yan or may damp heat. Alam na natin The urine does not smell but there is increased volume and frequency of urination. Issue ng ihi. Kaya, pero wala, hindi naman daw mapanghi. So, excess condition po ito ng excess and deficient cold. Pang strong smelling stools, ayun, kaya talaga yung iba. Paano sabi nila, maamoy namin nakatakip ng ilong. Mula ngayon po, huwag kayo magtakip ng ilong. So, pag sobra pong mabaho, excessive po yun or may damp heat. Pag ang stool naman smells of sewage, so may food stagnation. Ibig sabihin, hindi na digest lahat yung food, nandun lang, kaya na parang nabubulok yung amoy, ano. Strong smelling sweet, may damp po yan. So pag bad breath, siya po ay may stomach fire. Heat in the stomach or large intestine sa channel. Karaniwan ito yung sinasabi nila, ay may ulcer po ako. Yun po yung sabi ng doktor. Yan. Nasal mucus that smells or tastes strongly, lung phlegm hit po yan. So, pulmonary sputum that smells strongly or has a significant flavor. So, ang significance po nun ay lung phlegm, heat, or mayroon siyang toxic fire in the lungs. Pag strong smelling ang menstrual blood, dampit po yan. So, kasama na po natin tinatanong yun, ano. Pag strong smelling vaginal discharge, damp heat. Kaya pati yung talagang sasabihin natin sa pasyente, paki-observe po kasi malaking tulong to para mas maayos nating ma-diagnose yung inyong katawan. Kasi yung iba, ayaw nila, pero sasabihin natin na kailangan. Vaginal discharge, that's the smell of fish, damp cold po yun. Strong smelling, flatulence, damp heat. Flatulence without odor, so it's plain chi deficiency. Siyempre ito pong ano kasi mga part po ng mga babae yan, ano. Kaya siyempre yung pag-approach po natin talagang maintindihan nila kasi mamaya sasabihin nila, ba't ko na pinapakialaman? Parang ganun po, ano. Pero i-explain natin na bawat lumalabas sa katawan ay may equivalent meaning. Kaya explain natin, pati sila mismo ipa-observe natin sa kanila kasi dapat malaman nila na dapat hindi ganun yung amoy. Ang normal na amoy ay sinasabi natin kung ano po yung normal. Parang yung sa tang, dapat yung tang ninyo ay pinkish, hindi namamaga, yun po yung normal. Kaya mismo sila nagiging aware sa katawan nila. So, yun po yung makalagahan ng ating mga lesson. So, thank you po for your attention.